the World Health Organization, or WHO, that there was, quote, no evidence of significant human-to-human transmission. But as Chinese President Xi Jinping's government was trying to contain the spread of the virus, it also was trying to contain the spread of the truth.
Not a lot of folks out.
As CNN international correspondent David Culver found out.
It was back in late December when Lee sent a group message saying that a test result from a patient quarantined at the hospital where he worked showed a patient had a coronavirus.
Days later, Dr. Lee was summoned to a police station and reprimanded for circulating rumors.
On January 6th, Robert Redfield offers to send help, including CDC scientists, to China to look into the virus, to work with the World Health Organization. China does not want CDC scientists to come in the country at that point.
But the Chinese government's Great Wall of Deception could not stop the deadly virus from migrating beyond its borders.
21 people in Hong Kong returned from Wuhan with fever or respiratory symptoms.
Still, the Xi government insisted its investigations had, quote, found no clear evidence of human-to-human transmission.
In the early days, I don't think anybody knew for sure what to believe. So the concern was, are we getting the full story? How likely is this to be contagious? How likely is this to kill people?
It all seemed to leave U.S. infectious disease experts somewhat in the dark.
Based on the information that CDC has today, we believe the current risk from this virus to the general public is low. For a family sitting around the dinner table tonight, this is not something that they generally need to worry about.
But during that same teleconference, the CDC announced a handful of U.S. airports would start screening passengers arriving from Wuhan.
The new coronavirus is causing infections, fever and pulmonary infections.
U.S. intelligence agencies were warning the president about the novel coronavirus, according to the Washington Post, in more than a dozen daily classified briefings.
They were calling attention to the threat of the coronavirus in a way that amounts to a fairly steady drumbeat throughout January and February.
So eventually, Alex Azar, Secretary of Health and Human Services, goes to the president to talk about this coronavirus issue that is emerging from China. The president is completely preoccupied with other issues. He wants to talk about vaping and the sale of flavored vaping products. And it just shows you kind of how the president's focus was not on this coronavirus issue.
Which is worse, the impeachment hoax or the witch hunts from Russia?
His focus, much of it, was on the U.S. Senate.
And ready to present the articles of impeachment against Donald John Trump.
In his view, it was the so-called deep state, people in government who were hell-bent to bring him down. So by the time the coronavirus pandemic really started to worsen in the United States, and scientists and experts were telling him about the problem, he saw some of these people as just an extension of the deep state. And so that led to, I think, some of the skepticism that he had towards the advice he was being given.
And China's government, in late January, still downplaying.
Health officials in Wuhan held a press conference yesterday. They say this is preventable. They say this is controllable.
The next day, the U.S. had its first confirmed case of the coronavirus. The president's response was to claim it was under control. He said he trusted the Chinese government.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Okay, President Xi, there's just some talk in China that maybe the transparency isn't everything that it's going to be. Do you trust that we're going to know everything we need to know from China?
I do. I have a great relationship with President Xi. We just signed probably the biggest deal ever made.
Yes.
In terms, it certainly has the potential to be the biggest deal ever made, and it was a very interesting period of time.
Yeah, but let's get into
that. We got
it
it done, and no, I do. I think the relationship is very, very good.
We asked the White House to participate in this documentary, but they declined. On January 24th, Chinese authorities initiated a lockdown of 30 million people in 10 cities, including the presumed ground zero, Wuhan. Trump praised China, tweeting, "China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well." But behind the scenes,
health professionals across the government were tracking what was happening in China and getting alarmed.
some were sharing their fears in an email chain dubbed Red Dawn, originated by Duane Caneva, the chief medical officer at the Department of Homeland Security. An email chain leaked to the New York Times.
Emailing to each other that this is going to be bad. And we, the scientific community, the medical community, have to develop some real advice to policymakers to try to mitigate the potential damage.
Now I'm screaming, close the colleges and universities.
Exactly what came to pass 6 weeks later. But at the time, many in the Trump administration, including some of the medical community, including Dr. Fauci, were not ready yet to declare that those kinds of steps would be required.
An infectious disease doctor at the University of Nebraska shared this bit of dark humor. Great understatements in history. Pompeii, a bit of a dust storm. Hiroshima, a bad summer heat wave. And Wuhan, just a bad flu season.
David, hundreds of Americans were just evacuated today from Wuhan by the State Department. What precautions are being taken to make sure they are not carrying the virus back with them to the U.S.?
They went through not one, but two health screenings here in China, one done by Chinese officials, the other done by U.S. officials. And then they'll go through a third screening once they land in Anchorage and be cleared to then go on to California. Then, Jake, they're going to spend anywhere from 3 to 14 days in quarantine.
Peter Navarro, the president's trade advisor, circulated a memo through the National Security Council, but then it went out broadly to dozens of administration officials, in which he was very clear. He detailed the potential for millions of deaths, 1 to 2 million deaths, as many as 500,000. He went through the economic cost, which he predicted would be staggering in the trillions of dollars for the country. The president was told about the existence of this memo, we've been told by sources, and he was irritated that these estimates had been put down on paper.
That memo was dated January 29th, a day that also brought this.
The White House announced the creation of a coronavirus task force to deal with the threat here in the United States.
In the final days of January, a World Health Organization emergency committee praised the Chinese government's leadership, commitment to transparency, and saw no need for any travel or trade restriction. And Trump again told the country everything was fine.
We think we have it very well under control.
So the very next day after the president made those comments in Michigan.
And I issued a travel restriction from China.
The restriction stopped most Chinese residents and foreign nationals who had recently been in China from traveling to the U.S. The restrictions also started a clock.
When you talk to public health experts, they really look with despair at those couple of weeks because they say, whatever your feelings were on the travel ban at the time, it was a perfectly fine and reasonable step to take, and he bought himself a little bit of time, and then he just squandered it.
There were only 9 known cases of the novel coronavirus inside the U.S. The step to keeping that number low, according to the experts, was a working test for the virus.
Testing was, is, and always will be the cornerstone of trying to stem a pandemic. You've got to identify the people who are infected, you've got to be able to isolate those folks, and you've got to be able to treat them. It all begins with testing.
February 6th is when the CDC starts sending these test kits out to public health departments.
But the tests, the only tests approved for use in the United States, were not working.
Their hearts just sink when they're trying to use this test and it's malfunctioning.
There was a test available from the World Health Organization, but the CDC did not choose to get it. And nobody inside the government asked outside labs to help.
Officials were told not to do it, that they did not need to do it. It was too alarmist.
The delay in testing concerned the experts who now saw the virus spreading from human to human, and quickly.
I think it was pretty clear in early February that there was human-to-human contact.
Once we saw that this outbreak grew exponential rates, we knew this was going to be a rapidly disseminating virus.
Researcher Eva Lee was working to figure out how many Americans might catch the virus.
We build mathematical models.
Those models projected that between 2 and 10 million people in the U.S. would become infected. On February 9th, she sent an email to that Red Dawn chain of public health experts calling for social distancing.
We need the citizens to know and practice social distancing in a way that best protects them. Every action counts.
It was a full 5 weeks later before President Trump would take that step.
Thank you very much.
That same day, some of the nation's governors met with Dr. Anthony Fauci and CDC Director Robert Redfield. They got some disturbing news.
They gave us a pretty detailed outline of what they felt was happening with this virus. We knew that this was going to be a serious crisis.
It was exactly the opposite of what President Trump was saying publicly.
Looks like by April, in theory, when it gets a little warmer, it miraculously goes away.
The president's CDC director contradicted him later that week in an interview with Dr. Sanjay Gupta.
I think this virus is probably with us beyond this season or beyond this year, and I think eventually the virus will find a foothold.
Very small number of people in the country right now with it. It's like around 12. Many of them are getting better. Some are fully recovered already. So we're in very good shape.
He was still of the view that you could stop flights, build walls, and keep coronavirus from coming to the United States.
The chances of that were near zero, partly because it was now more than 2 weeks since the CDC test had been approved, and it still was not working properly.
Over at the White House, Robert Redfield, who's the director of the CDC, and Alex Azar, Secretary of Health and Human Services, are assuring other administration officials we're going to get it fixed quickly.
Not quickly enough. February 22nd, the Food and Drug Administration, or FDA, sent an expert to the CDC headquarters to help figure out the problem.
This expert realized that there was contamination in the manufacturing process and that the CDC had actually violated its own manufacturing protocols in trying to produce this test, and that is why the tests were malfunctioning.
You have to wonder if President Trump had been directly involved or his staff had, and if they had understood that you only contain the virus if you understand its spread, they might have pressed for more widespread testing earlier.
A little bit to their defense here. There were certainly indications that it was going to be bad, that it was going to spread, but there was no clear data, even in mid-February, on exactly how it was spreading through the United States.
But during the third week of February, public health officials were preparing for the worst, just in case.
They gathered in the Situation Room to run a tabletop exercise of what it would look like if the pandemic fully hit the United States. And so while the president was talking about 15 cases going to zero, they were talking about